Okay, so this is where we left off on video 1. And oh, yes. So hypothermia can either be induced or accidental. The purpose, as we touched on a little bit when we talked about hypothermia blankets, the purpose of induced hypothermia would be to reduce the metabolic rate so that we're not using and consuming as much energy, to lower cellular oxygen demand, and to reduce neurological damage. And then accidental hypothermia has 4 stages. So we talked about levels of severity, and then these ones are stages. So very similar to severity levels. In stage 1, patient is conscious, shivering. Stage 2, there's impaired consciousness and no shivering. So that's more like your mild hypothermia falls into shivering and conscious, and then moderate hypothermia, they can be in stage 2 or 3 hypothermia, and severe hypothermia, they're in stage 4, unconscious, no shivering, no vital signs. So prevention: dress warm, dress in layers, wear a hat, decrease exposure time, and to treat mild hypothermia as soon as it is noted. Also, if clothing gets wet, remove the wet clothing as soon as possible. Know risk factors and know your climate. So this is I like this little infograph about dressing for cold weather. 1 to 2 layers, a long layer underneath, outer layer, inner and outer layers, waterproof shoes, cold weather, extreme cold. Y'all, this used to be me when I lived in North Dakota. It would get to 40 below on every winter for weeks on end, and this is how I would dress to go to work. Couple layers, 1 or 2 bottom layers, plus my scrub top, plus scrub jacket, plus outer jacket, pulled all the way up, a hat, a face mask, or at least the thing zippered all the way up, waterproof boots, gloves on, and we call them long johns underneath my scrub pants to stay warm. So what's frostbite? Let's talk a little bit about frostbite really quick. So frostbite specifically is the freezing of skin tissues. So it's a freezing injury to the skin and the underlying tissue. So normally we know our skin has the epidermis, the dermal layer, and the subcu or the hypodermis or hypodermal layer. In frost nip, somebody say, "Oh, it's nippy out there." It's just the top layer, our epidermis, getting cold. Superficial frostbite is freezing through the epidermis and the dermis, and then deep frostbite is all the way down into the subcutaneous and into the muscle tissue. Frostbite tends to occur most commonly on any peripheral areas that are exposed. So that would be the hands, feet if they're not insulated well enough, and face and ears and nose. Even with this little gal over here, her nose is exposed, her hands and feet, as with all of our hands and feet, are the furthest away from our heart and have the smallest little capillary beds going down to them, so we don't get that nice, as much blood flow. Excuse me. So that's why we tend to get it on the peripheral areas. Nose, ears, feet, and hands. Freezing or frostbite starts occurring at 5 degrees below Celsius or 23 degrees Fahrenheit. So it's important to keep skin covered and to reduce exposure. When it was that cold, as when I used to live up in North Dakota, they'd say that frostbite could occur within superficial frostbite could start occurring within 5 minutes of exposure outside. So you didn't stay outside for very long at all. So what happens is these ice crystals, they actually start forming inside of the skin. This causes an increase in intracellular sodium. Initially the blood vessels dilate, but ultimately they vasodilate and become more permeable due to all this intracellular sodium. And the cells in the tissues swell because of the permeability of the cells. And then they get all swollen up, and then there's vasoconstriction and increased viscosity of the blood, and that leads to infarction and necrosis. What I want you guys to focus on are the clinical manifestations and how do we treat them. So at first, might feeling one, they feel cold, cold, stiff, numbness or prickling or itching as we feel. I think about like ice crystals forming inside of the skin is almost what you're feeling. And then toes at first are cyanotic, red and or white. There's a loss of skin elasticity, and then burning pain, especially as sensation returns. And have I experienced most of these? Yes, I have experienced all of these. Mild to mild frostbite clinical manifestations. In severe, there's edema, which we already touched on a little bit. So swelling of the feet or peripheries wherever we have frostbite. Blistering, you can get these cold, nasty blisters as the fluid, because of the permeability of the cells, and get a lot of fluid collections there. Necrosis, the dead tissue, we've already learned about that, and then of course gangrene. So what do we do with frostbite? First, remove, just like with rewarming, remove any damp, wet clothing, wrap them in a warm blanket, warm environment, hot liquids. For severe frostbite, rewarming of the limbs, they go in a hot bath up to right around, I think it's 107.6 degrees Fahrenheit for 20 to 30 minutes, no more than 30 minutes. If severe frostbite, need to seek medical attention. The biggest thing to remember is do not rub or massage. That's something that you see in videos and old movies and stuff. They're like, oh, we got to get you warm, and they start rubbing the hands and rubbing the feet, put them in front of the fire and everything. Don't do that. Don't rub or massage to increase the blood flow. Remember that the skin is actually frozen, and then you're going to take this frozen skin, and you're going to rub it all around, and you're just going to create havoc with the underlying tissues and create permanent tissue injury. So do not rub or massage. And warm environment, remember that ideal 82.4 degrees for the perfect set point, or a range of 81 to 86 degrees Fahrenheit for the warm environment. Get them in a warm blankie, and warm, hot, high-calorie beverage to warm up, because presumably if someone has frostbite, they have hypothermia as well. One does not occur in isolation. So you can have hypothermia without frostbite, but frostbite, you're going to have hypothermia as well. You can get on and Google hypothermia. It'll show you all kinds of wonderfully gruesome, or frostbite. It'll show you all kinds of wonderfully gruesome pictures. Or I think they showed some people with frostbite in that one movie they made lately about climbing Mount Everest. That was unpleasant. Anyways, so that is hypothermia and frostbite. And that's it for thermoregulation exemplars.